First, like a quick note.
Sorry.
I'm also just like a student, just like you guys. I'm a senior at UNC Chapel Hill. But luckily one of my friends knows Elise and is friends with her, and we did a study abroad program together. I currently study public policy at UNC Chapel Hill, and I'm in a dual degree program, and I study global health at Duke University. So that's where some of my interest comes from. But yeah, let's get started. And if you have any questions at any point, please feel free to like interrupt me or like if you want to mention anything that I didn't say in the presentation, also feel free to. But overall, I'm hoping just to keep this presentation super chill. But yeah, let's get started. Also, let me know if at any point you can't see the presentation. Um, the topic is about healthcare for refugees and displaced individuals in Nepal, Jordan, and Chile. So for context, this is a study abroad program I did last semester in the spring through the School for International Training. In case you're interested in a study abroad program, they offer it every semester, and this one was about human rights. And with my group, this is the topic we chose. But they also have other groups, other study abroad programs where it's specifically about global health or public health, and they take you across three different countries. Sometimes those countries are already predetermined, and there's other times where you can actually choose the three countries you want to go to. So in case you're ever interested in that, it's called the School for International Training. But yeah, let's get started. So just covering some goals for today. This presentation, like I said, is very chill, but I also want to acknowledge that this is a space that I'm hoping just to share some stories and experiences of amazing people who are serving others through healthcare access and advocacy. Also uplifting those same voices and those who are experiencing barriers and challenges within healthcare globally. Also, just hoping to serve as a moment of reflection and drawing connection between similar work and challenges happening in our local communities. Because as many of us know, it doesn't like take us to go take a flight somewhere else, right? To find something that we can work on that deals with healthcare, right? It can start in our neighborhoods. But yeah, let's get started with the overall presentation. So for this project that we did, this research project, we covered the question, how effectively can internationally displaced individuals exercise their right to health in Nepal, Jordan, and Chile? Just based off of that, I do want to give some key definitions, being who is it that I mean by when I say internationally displaced individuals? So rather than just saying a refugee, it is recognizing that the official 1951 Refugee Convention of what a refugee is can be limiting, and it does not include all of those communities discussed through our research, such as Palestinians and Syrians and Jordans who are refugees, but there's also asylum seekers, and also there's migrants fleeing severe economic, social, and political crises in their home countries, as is in the case is for Venezuela and Haitians and Chile. So like I just said, this research is going to take us around Nepal, Jordan, and Chile. And something that is always good to have, and as many of you guys know who have conducted research already or are going to, is recognizing your privilege and also your positionality. For me personally, this topic was very close to me because I am a daughter of immigrants. I am Mexican American. I come from a mixed status family, but I'm also a student at a college. So there's some sense of privilege there too. And I'm also not from these communities. For one of the countries I spoke the language Spanish, but for the other ones, there was also that language barrier. But just for some context of what these countries look like or how is this related to today, I do want to give some quick facts about each country, specifically who was the communities we were looking at and what is their migration patterns, who are they? So coming in, I actually knew nothing. So I'm very grateful for the opportunity to learn more about about them, such as in Nepal, right? Nepal is a country that's migration patterns are usually outwards, not inwards. So people aren't coming in the country usually, but those who are from Tibet and Bhutan, and there's mostly around 20,000 refugees at the moment. And there's also a small Rohingya population who are heavily discriminated against, and they're considered essentially what's the equivalent to the States, like an undocumented immigrant. And for the migration patterns there was some main arrivals of refugees taking place in 1959 with an influx from Tibet, and again in 1990 and 1991 with an influx from Bhutan. And then also between 2007 to 2016, UNHCR helped resettle more than 130,500 Bhutanese, refugees to 8 different countries, and one of the largest being in Nepal. Now for Jordan, as many of us may already know, Jordan has a lot of refugees. They are the fifth most populated of refugees in the world, and they have around 3 million Palestinians, beginning in 1948 and growing with every conflict that happens. Also, since 2011, they've had over 600,000 Syrian refugees. And there's also other smaller populations from people from Iraq, Yemen, Sudan, and also Somalia. Some of the key events that I also wanted to mention here, well, it's not all, but it is some of the main ones, it being in 1948, when Jordan received around 750 Palestinian refugees fleeing violence and displacement. Also, during the Six-Day War, where another wave of 300,000 Palestinian refugees fled to Jordan from the West Bank in Gaza. And also in 2003, in the Iraq War, where they received over 500,000 Iraqis, which only a fraction were registered as refugees. So something to note here is that only a fraction were registered, and you'll come to learn more what that means when it comes to healthcare in a little bit. And now with Chile. So Chile, it only has 2,160 UNCHCR recognized refugees, but many are asylum seekers. And there's also around 500,000 Venezuelan asylum seekers and migrants, and they're seen as a population of concern by the UNHCR. And they also have over 200,000 Haitians. And also, something that they mentioned to us is that these numbers can also be they can vary because there's also a lot of people who have came into the country undetected, or who are undocumented, right? And so there isn't a lot of stats on these individuals. For them, migration patterns look like from the 2000s to present, Chile had begun accepting Colombian refugees through the UNHCR resettlement programs. And then in 2019, the Haitian population peaked at over 185,000. And then they had also put in some restrictions in 2018 and put in a humanitarian return program. And so numbers did drop by 2022. A lot of the migration here is driven by economic challenges and authoritarian rule in Venezuela, where Chile became a key destination for Venezuelans seeking safety and work. And as of 2022, there were approximately 444,000 Venezuelan migrants in Chile, which is the largest foreign-born group in the country. And just going back to ethical considerations of all this research is making sure that when we were looking at who we wanted to interview, and when we did, we made sure that everyone had informed consent. Like I mentioned before too, recognizing positionality. And we had to make a difficult decision too of finding out who we wanted to interview, right? Well, many of us at first were thinking of, hey, let's do all the people who are experiencing these challenges, the migrants, the refugees, the displaced individuals. But with that, we did come to learn the limitations of not having those direct community connections. So a lot of our work did focus on getting information from policymakers and different people who are in the healthcare field on the ground. And then we did get to meet a couple people who are displaced individuals. And the few that we did were through community connections. So then our thesis statement became to be formed as access to healthcare for internationally displaced individuals in Nepal, Jordan, and Chile is limited by 3 dominant factors: difficulty acquiring legal citizenship and or refugee status, cultural and linguistic barriers, and ineffective policy. Throughout all of our interviews, we did have some key questions that we asked. For example, we asked, what are the most significant public health issues refugee communities face in your country? Do you feel the policies in place to provide refugee access to healthcare services are adequate? If not, what policy improvements would you most like to see? And 3, how does this legal status of refugee impact their access to healthcare services? And then overall, we also had 5 main groups that we divided up our interview, and it being individuals with disabilities, mental health, education, reproductive and women's health, and then the one I concentrated on personally was over labor and occupational health. So we found these 5 themes throughout all of our interviews. And then when it comes to asking questions specifically for each group, so for example, the policy experts, the health policy experts, we had more specific questions depending on the theme, right? So for example, we had, what sexual and reproductive health services are available in refugee communities? What changes would you like to see? Or are certain disabilities more common in internationally displaced groups? Now, for the refugee experiences, we also catered the questions differently. So, for example, within the labor health, occupational health portion, we had questions like, are you exposed to any physical health hazards in your line of work? Or what challenges do women in your community face in accessing reproductive and maternal health care? Um, so basically, now that I'm giving like some background on what the questions look like, who were the people who were answering these questions? So in Nepal, given that we didn't have that many access to organizations who were on the frontline workers, who were in the front line of these policy and healthcare fields, given that the organizations that do exist usually help for people who are returning from going abroad to Gulf countries and being migrants there. Um, the ones that we did have, for example, were Malakna Ansari, which she was the National HR Commissioner, lawyer, and activist. And we also had this amazing group called Friends of Shanta Bawan, which they are one of the only organizations in Nepal and in the Kathmandu Valley that provide free, low-cost primary healthcare that serve Tibetan refugees. In Jordan, we had Marian Al Jazeera, who also owned one of the only queer cafes in Amman, Jordan. It was a really nice cafe, but he also was a consultant for the UNHCR Disability and Diversity. We also spoke to refugees, three refugees who gave us the experiences, Palestinian refugees. We spoke to Syrian American Medical Society, Dravasian Human Development. Um, we spoke to someone from there who they lead a lot of youth programs, and also Farah, who was one of our professors and also a research and social worker in Amman. In Chile, we had people such as Delfina, she was the official UN High Commissioner for Refugees, Ana Carolina, who is a professor but also works at this nonprofit called Negrocentrics. Maria Osorio, she comes from the Organization of Colombian Refugees in Chile, and Eduardo Gardosa, who is a co-founder of Movimiento Acción Migrante. Just to have just to share a little bit of information of what they shared with us. For example, the Syrian American Medical Society, when it came to the questions, he did like highlight that, in his opinion, being a refugee does not affect their health in a specific way, given that a lot of the refugees he had seen do have this like permission to be in the country and be able to receive healthcare just like anyone else. And also, just since Jordan is a very integrated country and when it comes to their refugees. But he did mention that something that is a barrier here is the high cost for healthcare for refugees who don't have this UNHCR registration. So mostly Syrian refugees. So the high cost of healthcare was something that they address. He also mentioned there was a lot of barriers to mental health care due to societal stigma, especially for men. I remember a conversation with him, and he was mentioning how there was a local like mental health care hospital, and people called it like the crazy place. And if you were seen around it, then you would get a lot of like stigma and a lot of gossip saying, "Oh my gosh, did you see who went?" So that was something that was going on in the community there, right? Um, but something they helped also was providing training programs for Syrian medical students in camps and doing a lot of outreach and public health education to the communities. One of the ones that I was most closest to was Negrocentrics in Chile, and their mission was promoviendo la visibilidad, derechos y dignidad de las personas afrodescendientes. So promoting the visibility, rights, and dignity of people who are descendants, Afro-descendants. And some of the work that they did encompassed this advocacy sense of identity. And they gave us some context of what is that people are facing in Chile. Well, what Black people are facing in Chile. So, for example, she mentioned that there was a lot of Haitian mothers in Chile facing severe healthcare discrimination due to language barriers, xenophobia. And as they are one of the only few non-speaking international displaced groups, Haitians often experience fatal mistreatment. There was a key case that they told us about being Joan Florville in 2017. Something important to know about this case is that she was a mother and she had gone to a government office asking for help, but due to some lack of translation, this government official filed it off as a child abandonment. So suddenly, Joanne was placed in jail, separated from her baby. And at the jail, she was having a mental health care crisis and she attempted suicide and was taken to the hospital. She had injuries, and at the hospital, she was not being treated correctly, discriminated because of her race, and she soon died from a preventable medical crisis that was happening. So that's one of the bigger cases that have happened in Chile because of this xenophobia, the language barriers, and also racism that happens. And it sort of reminds us of what happens to the Black woman in the United States. And this is just a symbol of Black racism and also linguistic exclusion in Chilean institutions. There was there also during the interview, what came up was also especially this being seen in OBGYN wards and they're being displaced there and here being bias displaced. This just shows Haitian mothers and seeing how healthcare workers often assume that they are unfit parents. Um, since she had worked as like a community worker, helping a lot of women go to these appointments, she saw how a lot of these women were treated and how missing one pediatric appointment could trigger custody investigations over their children. And so there caused a fear of mothers going to hospitals and having their babies taken away. Another example that she gave us was about Dr. Rebecca Pierre, who was also a pregnant Haitian woman. And she was advocating for herself, saying at the hospital, no, like something is wrong with me after being discharged with a heart complication. She was still mentioning how she had pain and all these problems, but they were like, no, no, it's okay, go home, right? And so she did, and unfortunately, she passed away soon after. And this just reflects medical neglect and racialized disbelief in a woman's pain. So just some takeaways from here is just seeing how, in this case, it's Haitian women, how their experiences have been deeply rooted in racism, xenophobia, and like discrimination within Chile's healthcare system. And like I said before, it doesn't take like us to hop on a plane and go somewhere else. I think this happens too in the United States and all over the country of how Black women's bodies have been going through all of this. So now just for some of the more technical pieces of it, when we were going through all of these experiences that people shared with us or what they had seen through their work, at first we had around 15 codes, but we ended up narrowing it down to axial categories and further specified into selective codes. So that's where we went into choosing legal status, cultural and linguistic barriers, and also ineffective policy and implementation. So we had case studies, one being occupational health, and then under different policies, we also explored international policy, national policy, and also citizenship. And under culture, we had language, dismissal of cultural practices, mistrust between IDPs and residents, and stigma. Our case study here for occupational health in Jordan, and this is where I actually learned a lot about what is occupational health and abroad globally. So we concluded that, as I think as many of us know, legal status does heavily determine access to work and protections, just like it does in healthcare. And people who are irregularly documented face frequent physical, emotional, and financial abuse. In Jordan, for example, Syrian refugees can legally work per domestic policy and only in agriculture, construction, and general services. So this means that these are the jobs that they can work in legally: agriculture, construction, and general services, which limits their opportunities for different types of jobs and also increases injury risks. And while employers are legally required to provide safety protections and cover medical costs, many evade these duties. So there's a lot of undocumented and daily wage workers who avoid reporting violations due to fear of retaliation and high healthcare cost. One of the refugees told us, status determines where you can work, which in turn impacts workplace health risks. So here we can take away that structural labor restrictions and limited enforcement perpetuate unsafe work conditions and health inequalities for IDIs. In Chile, this looks similar. Now, they don't have a national policy that mentions, okay, you can only work in these places if you're a refugee, but it is common to see that a lot of Haitians and Venezuelans are working informally in agriculture, domestic work, and food delivery, where there's also, again, little oversight. Oversight is minimal and the risks are high. And also here, there's a lot of racial stereotypes Ana Carolina also mentioned how, for example, people who work in construction often hire Haitians because they are seen as strong people. And they think, okay, well, he looks physically capable. But instead of providing an awareness of what the job risks are to these individuals, they aren't. And they're also not giving the proper training or safety gear. So this puts a lot of people, especially in construction, at risk here. And there's also gender vulnerabilities happening, such as undocumented women facing sexual abuse and exploitation with limited access to justice. There's also, again, this fear of deportation, which prevent workers from reporting abuse. And while Chilean labor law is theoretically independent of migration law, it allows undocumented IDS to denounce labor rights violations. And Osorio mentioned that emphasized that workers are still subject to fines if they're caught without a work permit. So they rarely take advantage of this provision because if you report it, then you're charged and then you can get like a warning. And that can also just become filed and it can be like a suit for deportation further on. So just some things to have in consideration. And again, it just makes me think about like what's happening in this country today with undocumented immigrants. And let's say if someone is undocumented and is facing a challenge in the workplace, what are their avenues to report this? If someone gets hurt, can they access healthcare? A lot of questions come to mind, and it's a reflection of what's happening, not just in Chile, but also in the States. So I just wanted to highlight some key quotes. So with our three different codes, we have policy, which goes more into lack of funding, lack of follow through, and lack of communication. Um, Our informant from Jaravacine mentioned that the most important among them is the fragmentation of responsibility between the government, international organizations, and UN agencies. Jordan, as a developing country with economic challenges, cannot alone meet the scales of needs, especially as its own citizens struggle to access adequate healthcare services, which also affects refugees. So for context in this quote, he was also speaking about US aid and how a lot of it had been taken away from a lot of Jordan's community-based organizations and how he wanted people to recognize that this wasn't just a Jordan issue to deal with refugees, but a global issue. And again, I think here what is also mentioning is the scarcity of their resources and comparing what their own citizens are going through to what they can offer to refugees. Now, with legal status, we had Dr. Sampada from Friends of Shantabawan, and they mentioned that there are a lot of hurdles in healthcare for refugees, but one of the most important is their identification. They tend to be other people who visit our clinic, and they tend to be Tibetan refugees, but instead of using their surnames, they use Tamang Lama and Sherpa, which are local to Nepal and Kathmandu. So here we see people who are refugees in need of these services, but they don't want to say that they are because then they can be discriminated against or not offered services. So they end up changing their last names to go in line with the community. And then Ana Carolina from Negrocentrics. And this quote is regarding culture and linguistic barriers, dismissal, mistrust, and stigma. And here she talks about how xenophobia impacts Haitian mothers' access to healthcare in Chile, denying them adequate obstetric care through stereotypes, dehumanizing Black bodies, biopower surveillance, and culture insensitivity aided by linguistic barriers. So just having those quotes in mind, we put together a paper and we also just focus on these future directions and recommendations. Some of my teammates and I, we came up with these being the I'm so sorry, guys. I cannot speak today. It's almost 9 p.m. here, but the refugee recognition and also making sure that global healthcare isn't seen as a political thing, but as a human right and need. How it just shouldn't be political. Linguistic training, also culture sensitivity training for healthcare workers, and involvement of civil society in policy making and stakeholder integration. And then the last thing was increased monitoring of healthcare facilities and accountability. This is just a picture of me and my teammates working on this. We have Sarah from Emory, Lily from Penn, and my other classmate, Ray from Vassar. But thank you so much, guys. This is my presentation. And just one more thing before we open it up for questions. I did want to just to emphasize too, recognizing what is happening right now to immigrants and seeing how many of the topics that I talked about right now also is happening. I don't know if you guys have seen on social media, but there is a blame going on about this government shutdown, and there's a lot of quotes going out there of like how Democrats are keeping this government shutdown open, keeping this government shut down, given that there's people are providing healthcare to undocumented immigrants, which isn't the case federally. Um, so just a myth. And unfortunately, has become very political that people should have a right to healthcare. But yeah, just something to keep in mind. But thank you so much, and please feel free to ask questions or add anything else you'd like.
Thank you so much. That was an awesome presentation, and to be a part of a program like that, like I've never heard of a study abroad program like that that kind of sets you up to hear from so many different people and like especially the theme of human rights throughout the whole trip. You came up with a really great project, and I'm glad you got to share with all of us. And so if anyone else has questions, feel free to unmute yourself or to send some questions in the chat. But I at least can start with a question. So obviously you're not studying abroad right now. You're in your last year at UNC slash Duke. Um, from this experience, like, did it change what you would see for yourself in your career, or did it almost like emphasize that a career choice that maybe you made before the trip is for you? Just to talk about your future directions, where a lot of us are in the exact same boat as you, where we're figuring out what we want to do with our lives, and or what topics we think we could surround ourselves with for the rest of our lives. And so kind of what's next for you, or what do you think is next for you? And how did the study abroad trip impact that?
No, yeah, thank you so much. I think right now, as a senior, I'm like trying to figure out what I want to do. Like, yeah, like you said, like after graduation, while my concentration isn't global health, I took on the major because I found it being super similar to public policy, and I just wanted to interact with different kinds of people, not just people who are thinking of being like lawyers or policymakers, right? But people who are also wanting to be like the next caretakers for a generation. And I just see how there's so many differences in the conversations I have with the different sets of people. So that's one of the reasons why I took on the major. Also, I come from a farm worker family, and I also just saw a lot like how occupational health was so much of an issue. So hopefully in the future, I'm hoping to perhaps work like in labor law and like address a lot of these violations that are happening, especially where I'm from, rural North Carolina. Um, and I guess to that point, I saw a lot of like my personal like experiences too, just with people who are abroad. A lot of the agricultural workers in Jordan and Chile, and hearing their experiences. I just thought about my parents and my family who have and are farm workers. Um, I think, yeah, like going on, I hope to continue serving immigrant populations, while maybe not concentrating on refugees or something internationally, but staying local to my state.
That's awesome. Um, if anyone else has any other questions, feel free to either unmute or add it to the chat. I know there's a lot of information there in three different countries, and like, I mean, like Carolina got like I don't know how you got like 2 months in every country, sort of, right?
Yeah, like a month and a half.
About like a month and a half, and so she's very well versed in it. But we got like a few slides on it, so if you guys also have any questions about any specific countries, um, let us know. There's a question in the chat. I don't know if you could see it, but
Yes, it says, were there any overlaps you saw in public and global health while doing your research? I know you mentioned the overlap of Haitian women being treated similar to Black women in the United States. I definitely do think so, because some of the things that we also talked about was the public health care systems in each country. And while I didn't cover it right now because that wasn't our focus, I definitely saw like a lot of the same things that we experience in the United States when it comes to like for example, waiting long lines, or or having these different like experiences with going to private healthcare or public healthcare. The same challenges are being seen in both Nepal, Jordan, and Chile. Um, but yes, I know, yes, for the Haitian woman and Black woman, I just thought it was just when I first like heard her like talk about it, I was like, wait, it sounds like you're just talking about Black women in the United States, right? So I think also like coming to into the research, I was like hoping like to not have this like bias of thinking, oh, like everything's like better in the States. I'm gonna see how these countries are, you know, doing their own healthcare system, which might not be as great as ours, right? Um, Coming in, I definitely was recognizing like how our public health care system has not served many populations equally or just. So I was trying to figure out what initiatives maybe some of these other countries had, which I ended up finding not too many from the government end of things, like public health, but just like the United States, there's a lot of these nonprofits, or how they call them over there, they call them community-based organizations, at least in Nepal, or civil society organizations in Jordan, and how they have really been putting a band-aid on many of these problems that are systemic.
Awesome. Are there any other questions? Again, like you can send them through the chat or you can go ahead and unmute yourself. Sorry, I want to give enough time for people to do all of that. I know there's like
No,
a
that's
really
okay.
awkward
And
silence.
also, if there's not, no worries.
Yeah, that's okay. I mean, you have a long day. I mean, it's like almost 9 p.m. for you, but I'm sure other people have had a long day, and especially for people in BPH. We do have a meeting right after this too. But there is another question in the chat as well.
Yes. What do you feel is like the most valuable thing you got from the trip? Like whether it's practical or knowledge or whatnot. Um, oh, that's a hard one. I think definitely coming in, I had a lot of challenges that I didn't expect. I think one of the first things like my school was like, oh, like you might feel there's like a word for it. But when you're trying to adjust to a country, for me, I didn't have much of an issue like with that like cultural differences. If anything, it was with the group that I was going with. At first I was like, why are people so loud? Why are they like I had my own issues with the group of just like at the beginning. I felt people were very loud when we were going to like spaces and I was thinking, oh, like we're not in a space that like belongs to us, right? But over time I ended up getting used to it and in my mind I like they're my best friends now. But going in I definitely like had to learn how to like adapt to different people who are from the States, which was interesting because I thought the problem would be like with going abroad or any sort of like culture nuance I didn't know of. Um, Valuable thing, I think when I was abroad too, it gave me a lot of reflection because at school I'm very much invested in immigrant advocacy. And when I was abroad, I would always like have this like urge of and feeling of like, oh, I'm not doing enough. I'm not doing anything. I should be like at this protest at school. I should be like running this event at school. But it ended up like giving me a space to reflect more about how these communities are facing their own fight and with immigrants and like xenophobia and how I can learn from them and now which I'm hoping to use this semester when I'm doing immigrant advocacy work at school. So a lot of like just taking a break and like really just trying to make most of the moment and taking all my lessons learned and applying them to right now.
Awesome. If there's any other questions too, you can go ahead and send them in the chat and whatnot. But Carolina, if you wanted to send your like email or something, I'll send around your LinkedIn to the people that are here too, just in case people want to connect with you, or you could do that too, or I could find it right now. Um, but yeah, I think a huge part of what the hope for this Spotlight series is too, is I want to bring in student researchers like from our age group to one, show that like research or public policy work, all those different things are very accessible by people our age, especially for the freshmen out there. Like so many things are possible in your undergrad, especially like we both go to public, well, you have public, have private institutions, right? Or academic institutions that are invested in like our growth. And so much is possible, whether it means that you get to take a really cool trip and get to interview some people that you wouldn't otherwise, whether it means that you do public health research at UCLA. All these things are very possible. And on top of that, it's great to hear the perspectives from people in our generation as well. I think that not that our perspectives vary so differently or vastly across generations, but I think we speak in a way that translates better to people our own age too. So I definitely want a lot of people to hear from people our own age.
Yeah, definitely feel free to reach out to me if you had any questions about the study abroad program. Not to like promo them, but School of International Training, I think they do a really good job of like really like bringing in community members to teach you that all of our professors were people from the area who were knowledgeable. They weren't just like, let's say from UNC or Duke, right? They were people who were experiencing a lot of these issues. Um, and they also released this new program where you can actually like pick the three countries you want to go to. So
Oh wow.
you make your own study abroad program. So if you have any questions, feel free to email me too about it.
Yes. What was I going to say? Yeah, if there's any other questions, we're about to wrap up, but I want to say thank you so much, Carolina. I know that we got connected through my high school best friend, who went on the same trip and kind of is similarly interested in these exact same things. And so when I asked her, I was like, "Hey, do you want to like come speak about your research?" She's like, "Actually, I have a really good person for you who would be like 5 times better at it than me." So I'm very glad that you said yes, and I'm very glad that you got to present to all of us today. Um, I took the screenshot for anyone who's in BPH. So your attendance is recorded. Make sure to message Mia about it as well. But I want to give a big round of applause and thank you. And if you want to stick around, if you have any lingering questions, you're more than welcome to. But I'm going to go ahead and pause the recording. And thank you so much for coming today. I'll stick around as well. But I know some of you got to go to the meeting in Royce. So go ahead and get there on time. There's pizza today, I think.